Good afternoon, Mayor and Council. Thank you for giving us the opportunity to be here, and I'm sorry that I wasn't present for the annual council meeting. But that also brought me the opportunity to bring a lot more information to you and present what is it that we are doing for the city of Horizon and for the county in general. The Department of Public Health, as you know, depends from the city of El Paso. Before we used to be Paso City County District, which many years ago, it got dissolved and it was just in charge by the city of El Paso. And because of that, we need to have those interlocal agreements with each of the municipalities, including the whole county. The city of Horizon is a thriving community, and it was great to be looking down the window on my way here and see how much prosperity there is. I was happy to see the Hospitals of Providence having a facility, a very nice new facility, and many other businesses that are going to continue making the city a prosperous one. What is public health? And public health is not just providing the medical care to somebody. It's just promoting and protecting the health of communities, even cities, states, and the country. And that's why we were able to provide the response to the COVID-19. We are able to provide many other ways that we're going to be expanding and extending the life of the citizens by providing food inspection services, by giving education and recommendations, why we have to be wearing our seatbelts, looking at the science and looking at all the data that we are researching that is going to be expanding the life of our citizens. That's our job. And it takes immunizations, it takes a lot of public health professionals to be able to accomplish this job. We have about 15 programs, close to 300 employees, and an operational cost of a little bit over $7.5 million. But during the COVID-19 pandemic, we saw that all this was not enough. Why? Because there's many things that we need to do. And it took the whole county, not just the city, the whole county, to be able to provide that response. But at the same token, we also are kind of quote unquote deputizing each and every one of the community members, as well as elected officials, as well as other organizations, public and private, to be part of public health. Why? Because we want everybody to participate in the health of each and every one of us. The city of Horizon comprises about 2.59% of the total population of El Paso County, and that is according to the 2022 estimates of the census. I know that the last census was in 2020, but the census and the calculations that they do for 2022, that's what we come up. DPH services are available to everybody in the county. Many times, as we explained in last meeting, many of those services are confidential, meaning we don't ask where they're coming from, we don't ask the zip code, and we're happy to provide the services because we are the safety net to the whole community and the region. Unfortunately, the median household income for the city of Horizon is about $61,000, but 1 out of 5 people here in the county still lives in poverty. Why is this important? Because that's the public and that's the people that we serve. We serve everybody, but those are the ones that don't have any resources to go anywhere else. And we're happy to provide those resources to each and every one of those individuals, whether they're from Horizon City or whether they're from any other parts of the county. The house model that we have, it was a quite complex house model in which you would take into account all the assets. You was taking into account all the expenses. You was taking into account whether it was general funds or whether it was grants. But coming into a very detailed analysis of what was that going to cost to each one of the municipalities, I felt and we felt that it was not going to be sustainable, that it was not going to be possible to do that because the cost model was not changed for many years already. That's why every municipality was paying the same amount, which it was also not a sustainable approach to be doing that. So what is it that we come up with? Well, we looked at the general funds, we changed the part of the taxes and all the money that we needed to spend on the Department of Public Health. And that was the one that was distributed across all the county and municipalities. One thing that I would like to highlight is that the general funds is only 10% of the total budget of the Department of Public Health. We rely heavily on grants, and we're not going to be charging for that kind of money to the people of El Paso County. Why? Because those funds are destined to serve the whole community. We are charging for that. So we feel that that was not going to be a model that we were going to continue to calculate. And having that general funds model, it was going to be very transparent. It was going to be a lot more stable in the way that it was going to be addressed to each one of the municipalities. The advantages also is that no matter who's going to be in the position of the director, they're still going to continue having that same model for years to come. City Attorney's Office already known about this. And our assistant director, Lucera, also has been heavily involved. So there's a continuation and continuity of how we're going to be doing this process from now on. What are the programs that we serve for the county, not just the city? Well, we have a list of these services that we provide, in which many of the citizens have used. The one that is used quite a bit is the Women and Children program, which women from the time they're pregnant to the time that they get delivered, and the children are all the way up to the age of 5 can receive those benefits. We have mobile units, we have plans to establish a WIC office very close by here in the city of Horizon, where the citizens can come and apply for the services and receive those benefits. The Medicaid waiver, the health education and promotion, which are really very needed education in many public health topics, including sexuality, including how to prepare food properly, including what can you do when you have a chronic condition such as diabetes, hypertension. All the services are essential to be able to control and prevent also the citizens. Immunizations, which people, if they don't have a means to pay for immunizations, they are provided for free. Sexual health, STD services, and TV, those are services that are quite expensive. And again, we do a sliding scale. If they don't have the means to pay for services, we're happy to be able to provide those. HIV prevention, EIS services, where we look for those people that have these conditions such as HIV, syphilis. We're seeing a rise in the rate of syphilis and therefore congenital syphilis, not just here in our community, but across the state. And that has been a bigger problem across the state. Thankfully, because of all the implementation and because of the culture, we haven't seen that sharp rise in congenital syphilis in our newborn babies here in El Paso, but it is something that is concerning us. And again, the treatment is provided free of charge for those that don't have the means to receive those services that otherwise they wouldn't be able to receive the services. We have the 211 referral services, the laboratory. Food inspection is another one that is very, very common because with the new businesses, food trucks, food establishments, they need to have that license, they need to have that education on how to keep our population safe without causing outbreaks of food or analysis. The services provided, we divided into the proportion of the services that we provided throughout the year for the county, and we got a proportion of that for that are calculated for the city of Horizon. So because of the confidentiality, because there's not much objective way to calculate how many services are being provided to the citizens of the city of Horizon, the proportion of those services that were provided by the Department of Public Health are what I put over here. The total number of services provided by the EPH in FY23, over 2 million services. That includes education, that includes wage services, that includes in each one of the organizations, et cetera, et cetera. So the proportion of the FY23 for the city of Horizon was over 56,000. Up to now, fiscal year.
Excuse me, I'm sorry. If it's okay if we stop you there, you're going. When you say the proportion for Horizon that's based on the 2 point whatever percentage?
2.59%.
Okay, thank you.
Yes, you're welcome. Yeah, from the beginning of fiscal year to now, over 28,000. So by the end of the fiscal year, we're going to be doubling the number of services that we have already provided to the city of Horizon. And if we go a little bit more granular, this is the amount of services that were provided in total and in proportion to the 2.59% were for the city of Horizon. That's how we come up with that number. So I wanted to put that information so you guys can have a better idea what have been the services that have been provided, what has been the proportion of those. And then this is going to be the FY24. And Michelle has a presentation, so you have the numbers there with you. So you can examine it a little bit closer.
Why the reduction?
Pardon me?
Why the reduction from 2 million to 1 million?
Because it's from the beginning of fiscal year to now.
This is
So we're not completing the fiscal year, but if you were to calculate how much of those services are going to be by the end of the fiscal year, we're going to be double. And I'm happy to answer any questions. And I'm sorry, the last time that we were online, I couldn't hear almost everything, and it was very hard to hear this question. But I'm happy to answer any questions from anyone.
Well, Dr. Ocaronza, I'd like to thank you for coming out and being here with us today and going through this. Council, are there any questions from council? Yes, sir.
I'm struggled with this contract for many years.
Yes.
And I think the last iteration that we had was when you were mayor. And we finally, when it went to the city, we decided on a per capita assessment. Where your total budget was divided by whatever our assessment was in the population. Which is fair. Regardless of where the services are performed or anything else, we understand that part. And I didn't quite understand what you were saying just now about the grant income. Isn't the grant income, shouldn't that be part of the total?
Well, no, because the grand total is to provide services that should be assessed to you. And that's why coming up with the general funds, which is a smaller part, it was more making sense without having to increase so much into the assessment to each one of the municipalities. And I'll give you this example. Recently, we got $10 million. Okay, in a grant. If we were to spend the $10 million and assess $10 million and divided by the population of each one of the municipalities on top of what it was already assessed, the increase on the fee for the fiscal year was going to be so saturated.
So why would we be assessed for money that we're receiving? That should make the total, if it's money coming in for human services that the residents don't have to pay, why would that reduce our assessment?
Definitely, and that's why it took me a while to really assess what was happening and how the assessment was initially. And it didn't go down because of the amount of population that went out. Since you're a farming community, you have a higher number of people living in Horizon. That's why it didn't go up. It was going to be like 200% increase because of all the other models that we have.
Okay, you showed us your budget number, it's for 700 and something million.
Yeah,
$7 million something dollars.
Yeah, that was for the general funds.
Times, if you take 2.025% of that, which is our population, it comes out to about $175,000 where we were before. Is that not a fairly easy way to do that?
Yes, actually, as I remember the amount on the horizon, it was gonna be 44,000 or something.
Yeah.
Yeah, we have the number, and it was in the contract right there in the last page.
Just to clarify, sir, that amount of the.
I'm sorry, ma'am. Your name?
Sarah Cedas, Assistant Director for the Civil House Department of Public Health. And just to clarify, that 203,000 is also including the fee for environmental services. So we're adding,
So the environmental services budget is not included in that 7 million?
not in the 7 million that is for public health, but it is included in this $203,000 fee that is allocated for the town or for
But
the
that's a minimal amount. The environmental is a minimal
Yes.
amount. It's like $4,000.
Yeah. it's-
But it wasn't, I mean, we went from a budget, we were paying what,
180.
180,
177.
106 last year, that, but we're going up more than 20%.
I believe that it's gonna be for 2 fiscal years of, approval of that is,
No, it's
no, it's only 1 year.
only 1 year.
And we certainly understand about, and that's why we went to a per capita assessment. But it seemed like that the total budget divided by our population. And the way you presented your figures, it doesn't quite come out that way.
Let me have another question to the mayor. Yes, sir. Do you geocode the services that you provide, the addresses of the people that seek services? Do you geocode that?
In many patients, we don't collect the addresses of the people that come to receive the services. And in other ones, they don't wanna, as part of the confidentiality, we don't collect those addresses.
And I'm not too concerned about where the services are. That's part of public health. It's community, not a, so that's not a big deal. My thing is, if we have a certain population number and you have a budget number, that seems like a fairly easy calculation. And that's not what you showed us there. That's my one point. The other point is, we had, I talked to Lily before the meeting, and we had budgeted about, you said 2.5% increase or something in services based on our history to budget for this fiscal year. You're bringing us the contract that 20% over that now?
Yeah.
20% over that. We're halfway through the fiscal year. Does that mean you haven't been providing the services out here
We haven't even provided the services
without a contract?
without the contract. Okay. Yeah, we haven't stopped doing the services because public health is not gonna stop.
But you understand our issue is, we should start budget for the next fiscal year next month.
Because we're already behind.
So we're already behind. We're over 6 months into this fiscal year, and now we're just getting a contract.
And I understand completely that, and that's why having a process that it was gonna be more efficient for us and for you guys to have it, some of your budgeting, it was gonna be making a lot more sense. Definitely during COVID, there was hardly anything in all our efforts were dedicated to COVID. And I completely understand where you're coming from, because it's hard to budget. We're gonna have and yeah, it's,
And all these things, but, you completely understand, but is there any remedy? I mean, we've got to find a dollar.
the remedy. So the the answer for that.
And again, you're assessing of $206,000 this year. Is it gonna be the same for next year? Or should we add another 25% for next year?
No, definitely for next year, what we're seeing on the general fund is that it was gonna be remaining flat. So the increase might be just because of the per capita of the population. And it's gonna be very slight increase. And that's what we're budgeting right now. We're going through the budget again, when I did DPH. And the budget is gonna remain flat. We haven't been able to increase on the general funds.
Can we write next fiscal year contract now, if I'm saying that? And I say that sort of facetiously, but sort of not. Because that's what really bothers me is we're more than a half a year in, and you're asking us to sign a contract that's a 40% increase over what we anticipate.
Good evening, Mario D'Agostino, Deputy City Manager, City Hall.
I'm sorry, real quick. Can we fix that microphone? I think it's coming in and out, or I can give them this microphone. We can switch that one out, please. I turned it off. Or can that one be used? Because I want to make sure that this is. So, yeah, recorded for everybody. On record, let's say. That's mine, so I turned it off. Anyone? So, okay, there we go. I'll switch these.
That's yours, is yours off this? Yes. Right. So very good, Mario D'Agostino, Deputy City Manager, City Hall. I understand.
There's. Okay, let's try another one.
Yeah, okay. One more time. Mario D'Agostino, Deputy City Manager, City of El Paso, Public Health and Safety. I understand your concerns, middle of the fiscal year. It causes great difficulty. I think what brought us here today is we have not done an assessment years. That's why we're seeing so much of an increase. I understand your concern going into the following year and the following year. What are we going to do? Our general fund budget doesn't change that drastically on a year-to-year basis. So we wouldn't see this. It's the fact that we went so long without reassessing that the costs have truly gone up. I understand your concerns. I understand it's the mid-year of the cycle. I think Dr. O and his team can come back and we can look at a more stable, which you budgeted on, account for this year, but let it be known that this is what it is going forward, and we'll absorb that cost into next year. And so that's what you could be planning on and looking for your future budget. We apologize for that inconvenience, but it's just a matter of the fact. When is the last time we assessed this? It's been over a decade. So that's why it's such that one. That's why we're seeing that large increase.
We did this when you switched over from city county. Yeah.
That's correct. So I understand the difficulties it's causing right now. Let's look at it that way. We'll take it as what it was for last year's numbers, but let it be known that we're going to the following fiscal year, that these are the true costs. That's what they are today. Do we expect an increase? I don't expect an increase in the general fund for the public health budget this coming year. I don't. And so it's going to be very stable. If you did, you would, if you're going to look at a 0.5% to a 1% budget increase just with a city department like that, and then you calculate what percentage was your all portion, it's a very minimal. And so with that, if we can do this on an annual basis, we won't see these drastic increases when you wait a decade.
Okay, and thank you for that. That's a reasonable explanation. The only other point I'm at is, yes, there was a new assessment, your cost came in, you have something, I understand that that's going to happen. I still don't quite understand why the assessment has to be that difficult. Because to me, you can either put the environmental service numbers in there if you want to, but all grants, all general fund, that's your cost of operation.
That's correct. But when you look at it, you get those very large grant amounts. Why would we take that huge sum of money and put it towards to charges that we charge in this amount?
Well, why would you charge us if it's an income?
That's why we're not charging. We're taking that all separate. This is the general fund that keeps the personnel day to day, those that aren't on grants. So we're taking all of that, those dollars, that's what we're spreading around equally. And then the grants are spread equally as well. So we're just keeping that as a separate,
Because when you say grant, that's a plus to your revenue share.
that's a plus to our services, but we are not supplanting services. So what we pay on an annual basis is for the services we provide. The stuff that we're doing extra on an annual basis, that's provided through grants.
So then the numbers that you're showing us are not right, because we don't have grant numbers, right? Am I,
But the grant numbers are
yeah,
not in
am
there?
I not
or-
understanding that, or?
Those numbers that we present are not grants at all. Before, they used to take into account grants, and it was a very complex issue where there was hard to figure out where all the amounts were coming from. This amount don't take into account anything of the grants, it's only general funds.
And that's what I don't understand.
So
Why they don't.
I don't understand why you guys don't have the numbers, so with grant and without grant, right? That's what we want to know,
Well,
like,
I just want to know,
Yeah.
that you have a total operating budget,
yeah.
or a total amount of money that they operate on for the year. Our assessment is 2.5% of that. Whether, and it may vary the balance from year to year depending on the amount of grants you have.
But the 2.5% is based off of that general fund dollar, because that's what we're spending as a local health rep. That, when you look at the grants, that's above and beyond. We don't, if we get 10 million in grants and we have a $7 million budget, we don't say, oh, the city doesn't have to pay that 7 million this year, or plus 3. We're spending 17 million there.
Okay.
Does that make sense?
If, I'm okay with that, if that's the assessment of the board.
Yes. That's what's been changed across the board. That's what's been given to everyone.
And the general fund number you're talking about is a general fund number in the city of El Paso, but
It's in the budget book, yes, sir.
in the grants,
The grants will be there. 2%.
we have to depend on you to do that equitably, but you're the pros on that, so I'm okay with that. So in the future, how soon in the year can you give us a estimate of what your general fund budget is going to be?
We have a good idea of what our general fund is going to be going into the beginning of August timeframe. It's final, and now that budget's finalized at the end of August, basically.
And that's the rub, because we're starting our budget process in May.
And then you need to change your contract too, because it says that we'll have it by July 31st.
So we can look at that. Let's look at year, and there's different options. I'll talk to Dr. Owen and staff, and then we look at the year previous. So we're calculating off of the budget we spent for the previous year, and that's what we're building for the following year. That way it's stable. It gives you a number that you can work on. You'll know even longer what that number was like. So let me see what the possibility is that I'll do perhaps more talking about that. Does that make sense?
Just a question, Commissioner. Why the huge delay in getting this to us?
Huge delay was because there was no continuity in how this assessment of fees work. There was a big complex formula. I worked along with our fiscal, along with many departments, and because we didn't feel that it was going to be appropriate to assess that, and that's why we come to the drawing table so many times until we finally came with something that was comfortable, that it was going to be fair for you guys and for us, and to be able to have a stability in the way that we were going to be assessing that, because it hasn't been moved in many years. So if you notice, the amount didn't change, even though the budget would go up and down, and it was many increases because of the grants, but the assessment never changed. So how is it that throughout the years, it doesn't change, but it doesn't make any sense? The numbers should continue to reflect some variation, and there has to be an explanation for variation, which is what we're trying to bring to you then. That's why the huge delay in trying to figure the system that is going to be fair and more transparent, but also more predictable in the way that people think the budget.
It seems to be a trend because I'm involved in another entity and we've been waiting for an interlocal agreement renewal with the city will pass for 3 years. And, we don't know what to do now. If this is for, it's for, if it's for the story, but
Do you have any other questions?
Yeah, going forward, you listed these 15 services as your, does whatever grant income that you receive, does it support these services or is that in addition?
That supports the vast majority of those services, but the amount of general fund supports very small amount of each one of those programs as well.
So without the grant, if you were to provide the same level of service, then your budget would have to be well considered. Is that correct?
If we wouldn't have the grants, then we wouldn't have the amount of employees that needed to provide the same level of service.
But our assessment supports these 15 services that you, and I found somewhere on your website, I couldn't find it just now, but there is a report of, a monthly report generated of services. I couldn't find it just now, but I did see that, and these are in there.
Yes.
So my issue is not with that, it's how this came to us, and this huge increase that we weren't anticipating.
Are there any other questions?
Yes,
Council?
I have a question.
Yes, ma'am. Yes, ma'am.
You say you don't need the address, and that people say they live in Horizon.
I'm sorry?
Yeah,
That you don't ask for the address when they're asking?
Yeah.
You don't report that?
and that people say, oh, I live in Horizon.
We live in Horizon, but if we do not need the addresses, we don't save those addresses. There's some things that we might have addresses in Circle, but many of those we don't.
Yeah, it's because a lot of people live in Agualuces, Parks, Emerald Park, County, and said, I live in Horizon. Tell them not live in Horizon.
Definitely, and there's people that live even outside of the county, and said that they live in the county. But we take the population based on the census.
Which is okay.
Yep.
What we're gonna say. Well, look at.
Are there any other questions from council? No? Arthur, thank you so much. I appreciate your time. I appreciate your time. Coming in.
And we appreciate the help and request because all this helps us also.
I have a question for Louis.
Okay.
What is program?
Yes.
it's just, we pay the health district or the health, city health monthly, right? Is that what we do? We don't pay for one lump sum to city health services.
They bill us quarterly.
Yes, sir.
Can we find the, I guess it's about almost $30,000 to meet this obligation?
Right.
What would it require a budget amendment for? Probably require.
Yes, sir.
And if you'd like, I can have that language to the contract saying that we'll base it off the previous fiscal year. That gives you all plenty of time and it won't be this. Still, now that we're chewing up after the 10-year gap, it's not going to be a big increase. But this way you can go budget off of the previous fiscal year. So that gives you plenty of time to plan for your next fiscal. So we can add that to the contract.
Well, at the end of the day, we need public health. And so in light of that, I would move that we meet this obligation and authorize this contract in its full amount. And instruct Louis to find the money somewhere.
Easier said than done, right? So, thank you, sir. I appreciate the motion. Do we have a second?
I'll second.
We have a second. If you could please poll the council.
Miller,
Right.
Ortega, aye. Renville,
Sorry.
Lucille, aye. Tanya.
I,
Motion carried. Thank you again. We appreciate your time, sir.
Okay, on to item number 9, discussion and action.